Okay, let's dive right into this explainer. You know, cardiologists like Dr. Pradeep Jamnadas are seeing this bizarre medical mystery unfold literally every single day in their practices. We're going to look really closely at this whole phenomenon of calcium blockages, because right now, the very nutrient we've always associated with health and strong bones, well, it actually seems to be turning against us. Let's find out why.
So here is the ultimate paradox of the modern diet. We are seeing a total epidemic of 25-year-olds walking into clinics today with weak bones, a condition called osteopenia. And the truly baffling part? This is happening even though they are consuming tons of calcium-fortified foods. I mean, their milk is fortified, their orange juice is fortified, they're popping calcium and vitamin D supplements, yet their bones are still weak. And worse, doctors are finding dangerous calcium buildups right inside their coronary arteries.
Just look at this stark contrast. We are taking in all this calcium, but without a specific traffic cop molecule to direct it around the body, that calcium is just getting completely, hopelessly lost. So, instead of safely parking in our bones and teeth where it absolutely belongs, it's basically crashing into our arteries and soft tissues. It's plugging up the very vessels that literally keep us alive. Now, I want to speak directly to you for a second. Yes, you, watching this. The medical data is crystal clear here. The stiffening of your arteries, that loss of elasticity, it doesn't just suddenly start when you're older. This process actually kicks off in your 20s. By the time you hit your 50s and 60s, if you haven't been actively taking care of your vasculature, you're going to end up with stiff, calcified arteries. You might not have had a heart attack yet, but your physiology is perfectly setting the stage for major cardiac events, like a stroke or heart failure.
So, what is the solution to this terrifying mystery? Well, enter vitamin K2. This is a vitamin that goes largely ignored. I mean, you probably know about vitamin K1, right? But K2? K2 is the real missing link here. Decades ago, this dentist named Weston Price actually figured out he could cure severe dental decay using what he called Factor X, which, spoiler alert, we now know was vitamin K2. It's this vital nutrient that activates specific matrix proteins in your body, and it finally directs all that circulating calcium exactly where it needs to go, straight into your bones.
To really wrap our heads around the impact of this, we have to look at the data from the landmark EPIC study. They found this totally staggering statistic. For every 10 micrograms of vitamin K2 you have in your daily diet, there is a 9% reduction in cardiovascular risk. Like cardiologist Dr. Jim Nadas points out, there are very, very few pharmaceutical medicines out there that can boast that kind of direct, powerful risk reduction. And multiple studies echo this exactly. A 2009 study published in the journal Atherosclerosis showed this undeniable direct correlation between K2 intake and reduced coronary calcification. Get this, if you consume just 40 micrograms of K2, you're looking at a nearly 50% reduction in cardiovascular risk. The patients with the lowest intake, they had the absolute worst calcification, and the ones with the highest intake had the cleanest arteries. It's night and day. So stopping this calcium buildup radically improves something doctors call distensibility, which is really just a fancy way of saying the elasticity and compliance of your blood vessels. Basically, when your arteries aren't all rigid and gunked up with calcium, they can expand and contract nice and efficiently with every single heartbeat.
Because think about it, without K2, your arteries basically turn into stiff, rigid pipes. And when your heart has to forcefully pump into a rigid pipe, your top blood pressure number, the systolic pressure, it just shoots dangerously high. But your bottom number, the diastolic, which completely relies on the natural, bouncy, elastic recoil of the aorta, that drops dangerously low. And a super low diastolic pressure actually starves the heart of coronary perfusion, which is literally how the heart feeds itself. Honestly, it's a complete mechanical nightmare for your cardiovascular system.
But wait, K2 isn't just about the heart. Its reach across the whole body is incredibly vast. In the pancreas, K2 actually regulates insulin sensitivity, meaning a lack of it can flat out produce insulin resistance. In your mouth, having high levels of K2 in your saliva deposits dentine, practically curing tooth decay and cavities. Up in the brain, it regulates the microvasculature, meaning the automatic widening and narrowing of tiny capillaries, which might play a massive role in preventing Alzheimer's. And get this, in fetuses and growing kids, K2 prevents the premature calcification of facial cartilage, so a deficiency during pregnancy can actually lead to narrow jaws and upper airway obstructions in children. Crazy, right? the benefits even extend all the way into oncology. Having high levels of vitamin K2 circulating in the bloodstream has been linked to a massive 30% reduced risk of cancer overall. Specifically, studies are showing that patients with the highest levels of K2 in their bodies experience less prostate cancer and, crucially, significantly less spread of the disease if they do get it.
Okay, to really understand why just blindly taking calcium and vitamin D is failing so many people today, we have to look at this biological synergy. Step 1. Vitamin D does its job. It basically opens the door in your gut to absorb calcium into your body. Great, but that is exactly where vitamin D's job ends. Step 2 is entirely dependent on vitamin K2. K2 acts as that traffic cop we talked about, activating specific matrix proteins. And then step 3, those newly activated proteins grab the calcium by the hand and guide it safely into the bone, keeping it far away from your soft tissues. As Dr. Jamnadas puts it so perfectly, vitamin D's job is simply to absorb the calcium into your body. What the destination is for that calcium, that job is vitamin K2's job. This is exactly why just throwing vitamin D at osteopenia patients isn't helping if they totally lack the chemistry to direct that calcium. You can literally have all the calcium in the world floating around in your bloodstream, but without K2 to dictate the final destination, it's completely useless for your bones and, honestly, super dangerous for your arteries.
Now, here is a really surprising, kind of related fact about your oral health. The doctor strongly advises throwing away those harsh chemical mouthwashes. Why? Well, because they nuke all the good bacteria in your mouth. Bad gums create this sort of highway for bacterial products to enter your bloodstream, causing what's known as low-grade endotoxemia, which is basically just a fancy way of saying bacterial toxins are leaking right into your blood. And these toxins, they displace cholesterol, creating small, dense LDL, which is the exact type of LDL that causes atherosclerosis. So instead of harsh chemicals, the move here is using a good probiotic and vitamin K2 to cultivate a really healthy bacterial flora.
So the big question: how do we actually get this miracle molecule into our bodies? Well, since it's largely produced by bacteria, you'll find it primarily in fermented foods. The Japanese fermented soybean dish called natto that has the absolute highest concentration by a mile. But if that's not exactly your vibe, hard cheeses like Gouda and French cheeses like Brie are fantastic sources too. Kefir and sauerkraut have it in smaller amounts. You can also get it from meats and eggs, but only, and I mean this is a really big only, if the chickens are actually farm-raised, free-roaming, and eating their natural pasture-based diet. Now, for those who already have existing calcification, or really just anyone looking for an easier, more guaranteed route, supplementation is highly effective. Experts generally recommend taking 200 micrograms of the MK7 preparation of vitamin K2 every single day. This specific MK7 preparation has actually been shown to successfully slow down and flatten out the slope of coronary calcification. However, we need to pause for a second because it is incredibly important to note this one specific medical caveat. If you are taking blood thinners like Coumadin or warfarin, vitamin K2 supplementation absolutely will affect your PT-INR levels. That's the metric doctors use to measure how quickly your blood clots. So anyone on these medications absolutely must test their levels and consult with their physician before introducing high doses of vitamin K2 into their routine. Safety first, always. I want to leave you with a bit of a provocative question today. Go take a look at your own pantry. Is your daily supplement routine actually sending calcium to your bones, or are you unwittingly sending it straight into your arteries? It's just wild to think about how a previously unheard of molecule might just be the absolute most important missing link in our modern diet. Thanks so much for exploring this explainer with me today, and I'll catch you on the next one.